competent and what they deserve is availability. So can the Secretary of State advise us, is there any positive signals from Operation Moonshot? When will it be rolled out nationally, or is it another testing failure?
Yes, it's going pretty well, actually, and it's going to benefit the people of Scotland as well as people right across this united land.
So, Desmond Spring,
what advantage is there to be had from accommodating non-intubated COVID cases in Nightingale hospitals? And if there is an advantage, what additional facilities would need to be provided?
Yes.
Some of the Nightingale hospitals can take non-intubated patients, not ones that need full intensive care if they have multiple organ failure, but not all of them can because of the way that they're set up. We need the ventilators, we need the space, but we also need the staff to ensure that the Nightingale hospitals can be expanded as much as possible.
Foreign Session Lobby.
Thank you, Mr. Speaker. Yesterday, I received an email from my constituent, Anna Shipman, who's really concerned about the test, track and trace. And I'll read. I have a friend who's on a vaccine trial, and he has a routine test every Wednesday. And at the beginning of the trial, he would normally get his test results next day. Now, Anna is pregnant, and she told me that her friend met her on Friday. Then on Saturday, he met his elderly mum, who's 75. On Saturday and Sunday, he then went back to work as a full-time carer, exposing extremely vulnerable adults. He didn't receive his test results until Sunday. This system is a shambles, Mr. Speaker, and we need Secretary of State to highlight when we will protect vulnerable people who are being infected and not knowing because they're not getting results on time.
Secretary of State.
No, Mr. Speaker, the turnaround times are reducing, and whilst I absolutely pay tribute to the Honourable Lady for raising this individual case, it's very important to look at the system as a whole, where the number of tests is at a record level and the turnaround times are, I'm glad to say, reducing.
Jason McCartney.
Thank you, Mr. Speaker. Is the Secretary of State currently having discussions with West Yorkshire leaders about our COVID alert status? Does he anticipate any change to our current status of high in West Yorkshire this weekend? And finally, can he continue to be guided by the localised data?
The localised data is very important, that we take the action that's needed on the as local as possible, as we have done in Kirklees over the crisis over the last few months. We're in constant dialogue with the leaders of West Yorkshire, but no decisions have been taken.
Shanara Ali.
Mr. Speaker, Tower Hamlets faced one of the highest death rates in the country in the first wave of the pandemic, including for those among BAME communities. And for weeks, the borough's been given the lowest testing capacity in the capital, despite high incidences of positivity. Can I ask the Secretary of State to focus on the specifics and explain when he's going to get a grip on testing and tracing and localising it with resources, when he's going to get local authorities the resources they need and businesses the support they need, communities the support they need, and can he please explain today what action he'll take to produce the action plan that was promised months ago after the disparities report was published by his government?
Yes, absolutely, Mr. Speaker, and the Honourable Lady rightly raises the issues in Tower Hamlets, and the good news is that the testing being delivered in Tower Hamlets is going up. The bad news is that both the number of people testing positive and the positivity is also going up because of today's decision on putting London into level 2. That means further resources will be available for local test and trace.
Smith.
Can I thank you for allowing me to get on at the last bit because of the London statement. Can I say to my right honourable friend, when a minister gets a collection of London MPs together, it would be great if they could actually be allowed to ask a question for long enough time to save them having to scrabble into the House of Commons. The second bit is, I want to follow my right honourable friend, the member for Bromley and Chislehurst. London is huge, whether people like it or not. It is very diverse, and each of the boroughs, many of them, are bigger than most of the towns in the rest of the UK. Surely we need to look again at the nature of this London-wide Tier 2 position, because there could even be regional areas that could be taken out. There are big disparities. Please think again. Otherwise, as one constituent has literally rung me today, he has said, is this in fact a London-wide Tier 2 to stop the north-south divide argument running?
Clear State.
No, Mr. Speaker. This just on this last point, absolutely not. This decision has been taken on the basis of the data across London, and we did consider the borough-by-borough approach that he understandably advocates. But the decision that we came to is that because the cases are rising throughout the capital, therefore it was right for the capital to move as a whole, and that was supported by the cross-party team who are working on this at a London level.
Dr. Rupert.
Ealing shot up, and in the last week its cases have doubled, making it now the capital's coronavirus capital. So can I commend his approach to do a London-wide situation on this one, given the fluidity of this and of our city? And can he resist the siren voices from opposite saying otherwise? Also, could he look now at sort of additional funding for areas like my own and other interventions that could help? He knows my position on vitamin D. I wonder if he's considered it could be a high-impact, low-risk, cost virtually nothing thing that would make him a hero. What is he waiting for?
Yes. On the first point, what I'll say is I will listen to all voices, and the voice of my right honourable friend is far from siren. It is thoughtful, and it is considered, and it represents his constituents. And I will absolutely listen to and consider my right honourable friend on this side, my honourable friend at the back over here, and the honourable lady in trying to get to the best public policy outcome, taking into account health and economic and social consequences of these decisions that we unfortunately, these choices that we are unfortunately faced with. And I think that we should try to carry that approach of listening to all considered voices. On the point about vitamin D, I have asked the scientists to look once again at the impact of vitamin D on resistance to immunity. There has been some updated evidence that's come to light in the last few weeks, and I want to make sure this is fully taken account. And I can also tell her that we will be increasing the public messaging around vitamin D to make sure that people get the message that vitamin D can help with your broad health and that there is no downside to taking it and therefore people should consider that.
Thank you, Mr. Speaker, and thank you for squeezing me in. I thank my right honourable friend for his statement, and I also thank him for his response to the honourable member for Harrow East earlier. It is so vital that we do have a pathway and an exit plan to take London back to Tier 1 as soon as possible. I am particularly concerned about the impact of local people and businesses in my constituency in central London, particularly on the mental health issues that we are facing. I met a businesswoman on Friday in the City of London, a beautician who is now on antidepressants because her business is failing. Will my right honourable friend please assure me that there will be the funding and the services for mental health available as we go further into this crisis?
Yes, Mr. Speaker, my honourable friend is right to raise these issues, and these are difficult choices that we face. She has raised with me previously the need for the plan for exit so that we can motivate people to do what is needed to get the disease under control in London. In her constituency, almost more than any other, the impact of decisions to restrict social life has a very significant direct impact. But on both the economic and on health grounds, what I would say is that the need to get this virus under control helps on both counts. Because if you take into account, for instance, the mental health impacts, having spoken to the Royal College of Psychiatrists, they are really clear that the mental health impacts, if this gets out of control, are worse than the mental health impacts of the measures that are necessary to keep it in control. But nevertheless, we've got to ensure that the services are there as well to support people.
Thank
you, Mr. Speaker. I wrote to the Secretary of State on the 16th of September about the inadequacies of track and trace, and I acknowledge what he said today about the need for local and national teamwork. But I need to be further reassured that he will get track and trace right, because that's absolutely essential to dealing with the COVID-19 pandemic. London is now in Tier 2, and we've seen Manchester go from Tier 2 to Tier 3. So I want to ask the Secretary of State, we need to have a national circuit break for this to work, because otherwise we're going to have piecemeal Tier 2 going to Tier 3, and that isn't a plan.
Well, I would say to him, firstly, yes, absolutely, we're working. We want to work more closely with Ealing to make sure that we get that national and local link up in the test and trace system. I can give him that assurance. Just to be clear, in Enfield as well. Just to be clear that on the point about Manchester, no decisions yet have been taken on Greater Manchester, and I want to reassure colleagues who from Greater Manchester in the Chamber. And finally, I would say that having this targeted approach is really clear for people to understand. There are 3 levels. Everybody knows what's in each of the 3 levels, and it's very easy to know whether your area, which of those levels you're in.
Liam Ragg.
News from Greater Manchester, where the impossible has been achieved. All of the members of Parliament, the leaders of the councils, and indeed the Mayor, surprisingly, are in agreement with one another. The meeting we had earlier today was entirely pointless and may as well have taught to a war, quite frankly, Mr. Speaker. When are we going to be properly consulted, learn about measures through the right channels rather than via the media? And can I put a question which I posed to the Prime Minister to the Secretary of State now? The closure of hospitality will drive people into private dwellings where they will mix. We do not, thank goodness, live in a police state, for that would be the only way to police it. Can they please listen to common sense and think again?
Well, some of the evidence for the approach that we're taking is not only because we see this approach in other countries in the world, but also even within Greater Manchester. In Bolton, where cases were rising sharply, they were flattened when hospitality was closed there except for takeaways, albeit they have started to go up again since that measure was released. And so whilst I understand my honourable friend's urge for consultation, I'm very happy to talk to him at any moment of the day or night about these issues. We are seeking to work with the local area and with all of the elected representatives to get a solution that we can commend to the people of Greater Manchester, but a solution we must have. We cannot see cases inexorably rising because we know the consequences that brings.
Final question, Mike Kane.
Thanks, Mr. Speaker. I'm just slightly confused because on Monday, the Secretary of State gave up his valuable time to Greater Manchester MPs and confirmed Tier 2 with a 4-week review. This was Monday. He had the unanimous support, cross-party from Greater Manchester. As the member for Hazel Grove has said, every day it's been briefed in the press that we were moving to Tier 3. So I am grateful to the Secretary of State that his minister, the Minister for Havisham, has today announced that there is going to be a leak inquiry by the department. Today, again, there was full unanimity about Tier 2 in Greater